Hello, my name is Lisa and I'm one of the orthopedic patient navigators here at Royal Victoria Hospital. There are two of us here. My coworker, her name is Michelle. We work together to make sure that you are prepared for your upcoming joint replacement. Part of our job is to connect with our patients to make sure that you have things prepared before your surgery as well as your caretakers. We also help set up your physiotherapy in the community for after your surgery. Some of you we have already spoken to. Others we have not. If we haven't, please feel free to give us a call if your surgery is less than 2 weeks out, and we would be happy to have a conversation with you in regards to your upcoming surgery. Thank you.
Hi there everybody, my name is Karen. I'm a registered nurse working at RVH here. I work in the surgical department and I'm here to give you some information for your total knee replacement class. Everybody coming in to have this surgery is required to come to a pre-surgery treatment clinic visit. That'll be scheduled for you sometime in and around 2 weeks before your actual surgery date. During that visit, you will have all of your preliminary blood work, ECG, and all the testing that's required for your surgery. You'll meet with a registered nurse and we will go over all of your medical history. You'll meet with a pharmacy technician who will review all of your medications, and you'll have an anesthetic consult with the anesthesiologist. If you could please bring in your completed questionnaires prior to that visit, it just assists us when we're doing our assessments. And all of your medications in their original container just to help us with it as well. Everybody coming in for this type of procedure does a chlorhexidine scrub. So during your pre-surgery treatment clinic visit, we'll provide you with 2 packages that look like this. Inside is 2 pre-soaked chlorhexidine sponges, and we'll be giving you information on how to do that scrub as well. You'll get a piece of paper like this that reviews the instructions. What we ask everybody to do is have a shower the evening before your surgery. Completely towel dry off. Don't use any lotions or any products on the skin. You're going to open up this package, and with the 2 pre-soaked chlorhexidine sponges, you're going to wash right from the groin area to your ankle all the way around on the affected side. So if you're having a right knee replacement, it would be on your right leg. You can just let that air dry. It's odorless, it's colorless, so you don't have to worry about it staining any of your bed linens or anything. Wear clean pajamas. When you wake up on day of surgery, do not shower again, and repeat the process with the second package of sponges. They want it left on the skin. It just helps reduce the incidences of surgical site infections. Make sure you're doing a really good job with that scrub and that you're making it at least about 5 minutes long. Everybody will need to bring certain items into hospital with you. If you could come with your health card, all of the toiletries that you need during your stay. Please wear comfortable loose clothing because that's in fact what you'll go home with in case there's any swelling. And please bring in a closed heel and toe pair of shoes for when you're up walking in the hall. Comfortable and easy to get on and off if possible. We do ask that if you could please just have one person be the family spokesperson so that if there's any questions for staff, we can just address it with the one person so staff isn't being over inundated with lots of questions. You'll get a telephone call from a clerk the afternoon before your surgery to inform you of your arrival time and when you have to stop drinking your fluids. You'll be asked to come to central registration, that's level 2 right across from the gift shop. We ask knee patients to come in 2.5 hours before their prior surgery, and if you're having a hip replacement it would be 2 hours before your surgery. During that time you'll have a nurse that will review all of your medications with you, give you any medications you need prior to your procedure, start your intravenous and get you all set to go. After your surgery you'll spend some time in the post-anesthetic care unit and you're kept in that specialized area just until you meet certain criteria. Once you're awake, you're alert, your breathing is good, your pain's under control, then we would send you upstairs to the inpatient surgical unit. This is your healthcare team. Of course, you're at the top because you're the most important. You'll have a physician assistant that'll be the direct link between both you and your surgeon. You'll have a nurse assigned to your care at all times. and you'll have a physiotherapist, occupational therapist, who you're going to hear from later on in the presentation. And you will be followed by our acute pain service to make sure that all of your pain needs are being met while you're in the hospital. The average length of stay for this type of procedure is just one night. So you come in one day and you go home the following day. We do ask that you have that family member available to pick you up in the morning the following day, just for discharging. There is a communication board at the end of every patient's bed. So that way you'll be able to know who the nurse in charge is for you, if there's any tests that are going to be performed the following day, and it's also a good way if any family members or yourself have any questions you need addressed. You will have purposeful rounding, which means that the nurse responsible for your care will be around on an hourly basis just to make sure that you're doing well and if there's anything you need. Also, you'll have bedside shift report, and that's where the nurse caring for you gives a shift report to the nurse coming on shift right at the bedside. So it's a good way that you can be involved in that reporting, and if there's anything you need to have addressed, you can do it at that time. Everybody will be ordered pain medication after this type of procedure. The goal is, with any type of surgery, there is going to be some discomfort, but we certainly want you comfortable so that you're up, moving about, doing all the things that you need to do to go home. Everybody will be sent home with a prescription for anticoagulation, just to prevent any post-op complications of blood clots. We ask everybody to purchase an Aquacel surgical dressing. The cost is about $40. I know of two pharmacies that keep it in stock at all times. One is the pharmacy in the hospital, the outpatient pharmacy, and Ortho Health just across from the hospital. It's a good product. The initial dressing gets put on with your surgery, and then you're asked to purchase the second one, which you put on in the home at the 1 week mark. It's perfect, it's very flexible, it's got antimicrobial properties, and it's water resistant, so it's worth the money. The extra cost of the dressing can often go through your insurance company, or if you don't have extra benefits, it could be claimed for medical expenses.
Hello, my name is Jenna and I'm one of the physiotherapists here at RVH. I'm going to be talking to you today about what you can do ahead of time to prepare yourself for surgery and what you can expect along your journey from your inpatient stay into outpatient as well. So your rehab expectations at the hospital starts really the day of your surgery, and your rehab team includes a lot of people, not just the therapist, but it obviously includes yourself and many of the team members you'll cross along the way. So that might include your orthopedic surgeon, physician assistant, physiotherapist, occupational therapist, rehab assistant, and your nurse, and potentially many others. So as far as the course in the hospital and what you can expect during your stay, day 0 is we classify the day of your surgery. After your surgery and once you've come up to the floor and are awake, we encourage you to start moving and repositioning in bed, pumping your ankles for circulation. And once the block is resolved and your nurse has assessed you, they might determine it's safe for you to stand at the bedside and transfer to a commode or a chair. Day 1, so the day after your surgery, you'll likely meet your therapy team, the physio or occupational therapist, along with the rehab assistant, and you'll be getting up, going for a walk. If you need to navigate stairs, you will practice those that day, perform and review your exercises, and look over stuff of your daily tasks, like getting dressed, going to the washroom, etc. So I want to talk today a little bit more about sort of what you can do leading up to your surgery. Many people feel a bit anxious about the surgery, and the best thing you can do is get a plan in place and prepare ahead of time. So we're going to talk about how to prepare yourself, how to prepare your home, what equipment would be beneficial to have in place ahead of time, and your support network. So firstly, for yourself, it's important that you stay active and keep your body ready for surgery. Staying active can include different things like gentle walking, swimming, biking. If you haven't done exercise in a little while though, you might want to consult with your physician, physiotherapist, or surgeon. But anything you can do to keep yourself active is good. You might have to break up your task if you're having a lot of joint pain at this time, but we encourage you to keep moving as best you can. The other things important are pain control, controlling your pain so you can stay active. healthy eating, getting a nutritious diet to make sure that you'll heal well after surgery, as well as cutting back or stopping smoking, which has been shown to negatively impact healing, as well as drinking alcohol, as that's also shown to have more post-op complications. Some of the exercises, and these are straight from your education book as well, that you'll be doing after surgery, is a good idea to start doing them before surgery as well, so you get yourself used to it. The first image there is called static quadriceps, is really just pulling up your toes and tightening up those big thigh muscles and holding that for a good 5 seconds. You can hold it, release, repeat 10 times. Over to the right, we have the straight leg raise. Again, pulling up the toes, tightening up the thigh muscles, and lifting the leg off the bed. Again, all about control with your movement. Lower it down and repeat 10 times. Bottom left of your quads over roll is where you have a wedge or a rolled towel or even a firm pillow underneath the knee joint. Tighten up the thigh muscle, pull your toe up, and extend the lower part of your leg. Hold for 5 seconds, lower it down, repeat 10 times. And hip and knee bending, also really important to keep up the flexibility of your knee joint by sliding that heel along the bed and bending at the hip and knee joint. Go to as far as you can, hold it for a few seconds, feel a good stretch, and stretch it out and repeat again. 10 times, 3 times a day is a good rule of thumb. So next we're going to talk about some things to help you plan ahead to get your home and environment safe and secure. So first things, you want to look at your railings going into your house and between floors in the house and make sure that the railings are secure. This is also a great time to consider installing a railing where there may be a set of stairs that doesn't currently have one, as it is much easier to get up and down the stairs with the help of a railing after surgery. Also take a look at the furniture you sit on regularly, make sure that it's stable, make sure that it's at an appropriate height. It's much more difficult to get out of surfaces that are lower. Look at your environment in terms of the hallways into the main areas and making sure you remove any tripping hazards or any extra clutter, loose scatter rugs, anything that could get in your way while you're walking around using a walker, and to prevent any tripping. Think in your kitchen, your main areas in your bedroom and your bathroom about securing all the items you would need within reach so that you're not having to reach down really low or alternatively really high. And consider also night lights in your hallways to light up paths between the bedroom and the bathroom if you're getting up in the middle of the night. These are all things you should do anyways. So other things to consider ahead of time, again, just makes your life a lot easier when it comes to surgery, is preparing meals in advance, meals that are simple to reheat, that can be kept in the freezer. Arranging a family member or friend to stay with you. Consider supervision for activities like bathing and shower the first little bit. Scheduling help with household chores. Pet care, if you've got a big animal that requires a lot of activity, this is something you're not going to want to do after surgery. And making sure, we can't stress enough about having your transportation to all your appointments. So that's your follow-up appointment with your surgeon as well as your physiotherapy appointments. So as far as what your restrictions will be after having a total knee replacement, will be no kneeling, no pivoting, and no squatting, as well as no driving for 4 to 6 weeks. And this is something you can consult your surgeon if you have any further questions. So as far as equipment needs for after surgery, you're going to need some type of walker. Most people will find a rollator walker to fit their needs after a total knee replacement. The rollator walker is the one that has the 4 wheels, handbrakes, and a seat. The advantage is you can sit and take a rest if you're tired, and it's great for indoor and outdoor use. The 2-wheeled walker, it's a lighter framed walker. It is a little bit easier if you have a family member that's going to need to carry it up and down the stairs for you, but it isn't as good for outside. As well, you're going to want a cane, as the natural progression will be from using a walker to a cane. As well, you will use a cane if you have stairs with a railing to help you go up and down the stairs. There's also equipment that can be purchased or rented for your bathroom that makes life a lot easier after total knee replacement. That includes a bath seat, something stable to sit on when you're having a shower, as well as a raised toilet seat. And there's different variations of either toilet seat that's raised or just even purchasing the arms for the toilet to again help you get on and off the toilet. Other devices are a long-handled reacher, dressing aids like a long-handled shoehorn, a sock aid, again, things to consider if you're having difficulty already with those tasks, that it might be a little bit more difficult after surgery as well. So we will be asking you this once you're in the hospital, as well as even in advance of surgery, is making sure you have a clear, concrete plan for after your surgery. So this might include staying in your own home with family members or friends helping support you, but it might also include considering going to stay with a family or friends for first while, so you're not on your own in your own home. The other option you have, if you're finding you don't have anybody to stay with, or you don't have anyone to come to stay with you, consider a short respite stay. And these are rooms that are in retirement homes in the community that'll just have some extra support. This is something, though, you need to arrange ahead of time on your own, that is private pay. So when we're looking for goals for discharge home, from our perspective, from rehab, we want to make sure that you're able to get in and out of bed safely, get up and down from different surfaces safely, walk using your appropriate gait aid, be able to manage the stairs, wash, dress, toilet yourself, and making sure you understand and can perform your exercises independently. The discharge home is your stay, as mentioned earlier in the presentation, is about 1 day. So your surgery is on day 0, and that next day is the goal of discharge. So it's 1 night in the hospital. So your therapy obviously doesn't end there. Once you're at home, you want to make sure you're continuing doing your exercises 3 times a day, 10 repetitions each, continuing with your walking and gradually increasing your overall activity level, monitoring things like pain and swelling, making sure you're taking your pain medication appropriately so you can still do your exercises and stay active. Ice packs are another great way to keep the swelling down and help manage some of the pain. We encourage that quite frequently, and you can do that 20 minutes every hour or 2, especially following exercise, most people find helpful, and making sure you follow your instructions from discharge on your incision care. So once you're at home, as we mentioned, you're continuing with your exercises, but you're also you're starting your follow-up appointment for physiotherapy. So this is something we encourage you to arrange once you know your surgery date, have a place set up in the community. The goal is to start your physio as an outpatient 7 days or 1 week after your surgery date. You have the option, and there's a list there in the book of some places you can go. You can do it here at the local hospital. There are some clinics for OHIP coverage, as well as any private clinic. Nextly, the staples will be removed 14 days from your surgery date, and this can be done sometimes at the family doctor or the surgeon, but your surgeon will guide you when you leave the hospital what their preference is there. And typically your surgeon will follow up with you 4 to 6 weeks after surgery at the fracture clinic here at the hospital. And again, we can't highlight enough the importance of making sure you plan for transportation for all of these appointments. Any more specific questions about resuming any previous activities you had, you can take these to your surgeon at the follow-up appointment as well. So as far as the recovery timeline for a total knee, just remember that everybody's recovery is going to be a little different. Do not compare to a friend or a family member who may have gone through the surgery, as everybody is unique. But the first week to 6 weeks is where a lot of the progress happens in terms of progressing with your exercises and your mobility, but expect changes can happen all the way 3 months up to a full year. I know that you just got to stay persistent with your exercises, even though there might be some days that the exercises are feeling difficult or you're not making progression. I can't emphasize enough the importance of sticking with the therapy to maximize your outcome from your total knee replacement. There's some additional resources here on the screen as well. I don't know if that makes sense.
Yeah, no, that makes sense.
You will see some additional places and resources you can access just about information about a total knee replacement. There is a lot out there. Also look at your pre-op education booklet for any further details as well. Thank you. Thanks for taking the time to listen to this pre-op knee education. Please take this next little bit of time leading up to your surgery to get yourself as prepared as possible going into your surgery. And best of luck for the road to recovery.